So frozen shoulder is one of the most painful conditions you can ever experience. And to get better, you've got to do the homework. And so we'll be recommending certain exercises in the office, and we're going to demonstrate a few of them in this little set of exercises. It's important to remember this. Don't push yourself to the point of pain. You take it to good pain, but not hurting pain. If you take these exercises constantly to hurting pain, you'll make the shoulder more inflamed and it'll actually get worse. So it's important to do these 2 or 3 times a day initially. The more you get done, the faster you unfreeze this shoulder. If you don't do these exercises, it's going to be a long, slow drag out. So we're going to show you a couple of exercises and video demonstration. What I like to say, if you have the time, it's a good idea to put your hot pack on your shoulder. Let's pretend I have a right frozen shoulder here. Put your hot pack on it for about 15 minutes to loosen it up. Then do the exercises that I prescribe for you in the office, and then put an ice pack on it for 10 minutes afterwards. So it takes a little time, I know, but if you really want to fix a frozen shoulder, this is what you got to do to get better. So one of the first pieces of equipment we give a frozen shoulder patient or a person with an impingement where they can't raise up their arm is an over-the-door pulley. So it goes over the door. It has a little knot in it here that goes over the door, and the door secures the pulley. If you're doing a right shoulder, you want it over the right shoulder. If you're doing a left shoulder, you want it over the left shoulder. We'll show you that in a second. The pulley also has, if you look closely here, little black marks every so many inches on it. They're little Sharpie marks. So what you do the very first time when you hang this up, and I'll show you, is you figure out how long your arms are, and if the pulley's going to be all the way to the end, the little handles, you might have to tie a knot in there so that it's more comfortable, so you're not overextending your arm's reach. That's the purpose. Somebody may have to help you with this the first time you put it up, help you identify where you should tie the little knot. If you make a mistake, no big deal, untie the knot and tie it over again. But this will allow you to customize the pulley to your arm length and body style. So for demonstration purposes, we're going to assume I've got a right frozen shoulder. So I'm going to place the pulley right of center on the door. Whoops. Like that. That secures the pulley. Now, I put my chair back against the door, and I want to sit comfortably in good posture. Untangle my rope. So, with my bad arm, in this case my right arm, I'm going to straighten my arm and start where it's comfortable. For some people with a frozen shoulder, this is about where they have to start because they can't get the arm up much higher on their own. So just let it hang there. This arm is controlling it, okay? So you're going to keep your thumb up. Always remember, thumbs up. If you do it with your thumbs down, it's not going to work very well, and it actually will hurt your shoulder. So thumbs up all the time. I'm relaxed, and now I'm with my left arm. I'm going to start to pull my right arm up. I'm going to let my right arm totally relax to a point where that's about as far as I want to go before it really starts to hurt. Hold it there for a second, and then lower it with your left arm. Let your right arm come down. It shouldn't really hurt at all if you're doing this correctly because you're using your left arm to do all the work. You're just helping your arm up and down to lubricate the joint, okay? And you're going to work the arc all the way forward and all the way backwards. Notice as I let it come down, I'm coming forward, and I'm going to pull up to that point where I want to stop, and I let it come down. Move it forward, pull up, and let it come down. Now, once I get all the way forward and up, then I'm just going to reverse and go backwards with it again. So I start back. So it probably will take about 10 repetitions each way. Might take 20 repetitions total to make that arc forward and backward. And I'd like you to do this exercise 3 times a day. Remember, the more you do this, and if you do it correctly, the faster you're going to start to get your shoulder range of motion back. The faster the pain is going to go down, you're going to sleep better, and the pulley will become your friend. This next exercise I call a towel stretch. So when you have shoulder problems, rotator cuff, frozen shoulder, shoulder impingement, goes by a lot of different names. one of the things that we lose is our ability to reach behind our back. So when that happens, we've got to find a way to stretch that so we can get our arm back up our back. In other words, if I have a person with a right shoulder problem, many times they can do this with their left hand, but they might only be able to do this with their right hand. So we want to try to get that back if we can, and this is a good stretch to do it. So we're going to take a towel, like a bath towel. It has to be a long towel. Let's say my problem's with my right arm, shoulder. I'm going to drop the towel behind my back. I'm going to stand in good posture, and I'm going to comfortably grab the towel. I'm not going to try to go way up here. I'm going to grab it wherever I comfortably can. Notice my palm is out. I'm not grabbing it this way. My palm is out, thumb up, right? And then I'm going to start raising my left arm. My right arm is going to relax, and I'm going to take it up to a real good stretch, but not pain, just a good stretch. Then I can lock it down like this and let my left arm relax. And I'm going to hold that for 10 to 15 seconds. You got to hold it for 10 to 15 seconds to get a good stretch. Let's say 15 seconds has passed. I bring the arm up, and maybe I get another little 1/8 of an inch or so. Bring the arm down again, 10 to 15 second hold. And then we repeat it one more time. See if we can get a little more without creating a lot of pain. Just a good stretch and hold it. Now, what I like to do at the end of this stretch is now get some active range of motion where you're going to fire your muscles. So we'll drop the towel, and then we'll just try to do what we can just by bringing our hand back behind our back now. Notice I'm not trying to do weird stuff. I'm going to stand in good posture and just take whatever I can get, and you repeat that 2 or 3 times. Now you're firing those muscles that have to lift your arm back up again. So you start with the towel stretch, and then you do a little active movement afterwards, and do that 3 times a day until you get your range of motion back. So with a frozen shoulder, one of the common ranges of motion that we lose is the ability to bring the arm out. It's called external rotation. So here's a cool way you can stretch this along with your pulley exercise and the towel exercise to get that range of motion back. So you find a doorway. Notice I'm going to keep my arm at 90 degrees, and I'm going to keep my elbow gently tucked at my side, and I'm going to put it into the back of the door with a flat hand. And I'm putting it in a position where it doesn't hurt my shoulder. And then I'm just going to turn my body away from it to stretch it, right? Instead of trying to do this with my shoulder, I'm going to let my shoulder totally relax and turn away. And it's a 10-second hold, not to the point of excruciating pain, but a good stretch. Hold for 10 seconds, and then you relax. And you would repeat that 3 times, taking it to that good stretch without pain, holding for 10 seconds, and relax. Repeat 3 times.